Hi everyone, welcome to week 7. So this week we are discussing trends. So our objectives for this week from the syllabus: analyze societal trends that are likely to impact nursing education and patient education in the future, and analyze multidisciplinary strategies to maximize the positive impact that societal trends will have on nursing ed and patient ed. Okay. I did like the lecture provided by GCU this week. I think that it really hit on a lot of the current trends that we are seeing and will need to be addressed. And then we've got that list of 23 societal trends that were developed quite a while ago. But it's really interesting how we have seen a lot of those come to fruition, right? So it'll be interesting to hear your thoughts about that. Okay, so one of the biggest trends that I see in nursing education is knowledge or content overload. It's sometimes called additive curriculum. We keep adding in more and more things that we need to talk about and make sure our students know about. Geriatric specialized care, treatment based on genetics, incorporating palliative care, and all of those new meds that we need to give, right? So we need to have a way to get at the most important information so that nurses can actually function at the bedside, right? With all this new stuff that's going on. So I talked a little bit about this at the very beginning of our course when we talked about clinical judgment. Well, how we get to clinical judgment is we're moving from a traditional curriculum more towards a concept-based curriculum. That's a huge trend in nursing education today. And we're moving more from memorizing to pattern recognition in our patients. We're moving from discussing facts and tasks to hopefully thinking like a nurse. Let me give you some examples. Okay, so at an institution, a BSM program that I was teaching at, we were trying to incorporate some of these components, and we're kind of in the process. So I was teaching in a foundations or fundamental type course, and we broke down areas to focus on concepts such as oxygenation, perfusion, mobility, elimination. So this allowed the students to start focusing on patient processes and patient responses. So what does effective oxygenation look like? What does ineffective oxygenation look like? What can the impact on the body be if you have ineffective oxygenation? So looking at those broad concepts, and then as you learned more specifically about specific patients, you had something to hang those facts on with these broad concepts, but you already have a picture of how your patient might be impacted. Okay, another example, I was teaching in a med-surg course, and instead of designing the syllabus based on lists of diseases, okay, we looked at topics such as care of the neuro patient, care of the neurologically impaired patient. So that would be our concept. What does care of any neurologically impaired patient look like? So we needed to look at what do you need to explore or assess with any neurologically impaired patient. And then once we had that broad concepts, once those were cemented, then we could look at some example diagnoses and some of the differences between them. But we could not discuss every single neurologic diagnosis that a new nurse might run across. But if you know all the different aspects that you should look at with a neurologic patient, regardless of what the diagnosis is, you're going to start zeroing in on what the priorities of care are for that patient. Okay. concept-based learning can also be across the curriculum. So maybe I'm taking this component, this concept of caring for a neurologically impaired patient, and I might have different instructors teaching components of this. What does that look like in the neonatal population, the pediatric population, the adult population, and the geriatric population? Are there specific concepts within those populations that might change our perspective a little bit? Again, in a broad way, really focusing in on patient needs. I know it's a little hard to kind of wrap your head around if you're used to a very traditional curriculum. And so in the end, you end up with a nurse who might not be able to rattle off teeny little facts and minutia about every single diagnosis, but they can critically think through what the patient's priority needs are. And that tends to be much more what we need at the bedside: identification of patterns, trends in deterioration, prioritization of the most critical needs. What do I need to address right now in my limited amount of time? So I'm going to attach some information, I think a couple PowerPoints probably, about concept-based learning, about what concepts different universities might select, how they organize their curriculum. So as you have time this week, take a look at those, and then hopefully we can discuss that a little bit. Probably for the majority of you, this might be a bit different from how you were taught in nursing school. Okay, on the clinical side, we also only have so much time for initial new nurse orientation and continuing education, professional development for our nurses. What's the most effective way that we need to get across this information? Could we use concept-based curriculum, a concept-based approach, to get our nurses thinking more critically as opposed to memorizing steps and details? So concept-based learning can be applied in the clinical setting as well as the academic arena. Okay, so just a little bit to whet your palate there. Okay, so as you're starting to work on your final projects, final papers, individually and as a group, I would encourage you to post questions in the questions for the instructor forum. You can do them in the individual forum too, that's fine. But what I find is if one person has a question, almost always somebody else is thinking that same question. And I noticed today, I think at least 2 people posted something in the questions to the instructor forum. So be sure to take a look at that, because anything I respond to is going to help you with your assignments. But anything we can do to share information and help each other out, my goal is I want you all to be successful, right? So please try to use that forum. And I'm looking forward to another great week of discussion with you in the main forum. I'll see you there.